Reflection on virtual hospital simulation, maternal and child health. Introduction. Simulation-based learning is a powerful educational tool in nursing education. The virtual hospital simulation provided a realistic and interactive learning environment that enhanced my understanding of maternal health assessment. This reflection explores the effectiveness of simulation as a teaching method, its impact on clinical reasoning, and how this experience contributes to my future practice. Effectiveness of simulation in teaching. Compared to traditional teaching methods, the simulation was more engaging and immersive. Instead of passively absorbing information through lectures, I actively participated in the learning process. The interactive nature of the simulation allowed me to visualize real-life scenarios, reinforcing theoretical knowledge with practical application. Key teaching strategies incorporated included: experiential learning. I was placed in a real-world clinical scenario, requiring me to assess, analyze, and make decisions. Immediate feedback. The simulation provided instant responses to my choices, helping me understand the consequences of clinical decisions. Self-paced learning. I could navigate through the scenario at my own pace, revisiting concepts as needed to reinforce understanding. Interactivity and knowledge application. The simulation promoted active learning by requiring me to engage with patient data, analyze symptoms, and apply clinical judgment. Unlike traditional learning, where knowledge remains theoretical, this experience allowed me to see how prenatal assessments are conducted in practice. For instance, assessing Maddie Fraser's symptoms, reviewing her history, and making decisions about her care enabled me to integrate multiple aspects of nursing practice. This strengthened my ability to connect theoretical concepts with practical applications, improving my clinical competence. Critical thinking and decision-making. The simulation demanded real-time decision-making, challenging me to evaluate patient data critically. This experience enhanced my clinical reasoning skills in several ways. Prioritization. I had to determine which assessments and interventions were most urgent. Problem solving. The scenario presented unexpected developments that required quick thinking. Evidence-based practice. The simulation encouraged the use of clinical guidelines to support decision-making. By engaging in this process, I improved my ability to assess situations logically and respond effectively, skills essential for patient safety and quality care. Challenges and improvements. The simulation had several strengths. Realism. The scenario closely mirrored a real prenatal appointment. Engagement. The interactive elements kept me actively involved. Skill reinforcement. The experience reinforced clinical and communication skills. However, some limitations included: limited human interaction. While informative, the lack of real patient interactions reduced the opportunity to develop soft skills such as empathy and adaptability. Technical barriers. Navigating the platform required familiarity with digital tools, which could be challenging for some learners. Improvements could include integrating live mentor support, offering more diverse patient cases, and providing enhanced virtual communication features to better simulate real-life interactions. This experience broadened my perspective on digital learning in nursing education. It demonstrated that simulation-based learning is not only effective but essential in bridging the gap between theory and practice. Moving forward, I will incorporate more simulation-based exercises into my learning routine to strengthen my clinical judgment and confidence. I would highly recommend this learning method to other nursing students, as it provides a safe space to practice decision-making without the risk of harming real patients. Conclusion. The virtual hospital simulation significantly enhanced my understanding of maternal health assessment by promoting active learning, critical thinking, and clinical decision-making. While there are areas for improvement, the overall experience was invaluable in preparing me for real-world nursing practice. Simulation-based learning is a transformative approach that should be integrated into nursing curricula to better equip students for their professional roles.